What is stakeholder engagement in community health initiatives? Imagine a neighborhood where everyone's voice matters when it comes to health. That's what stakeholder engagement is all about. It's a way for organizations to work closely with people and groups affected by health programs. These groups include doctors, patients, local government, community groups, advocacy groups, and residents, especially those facing social and economic challenges. The goal is to build partnerships so everyone can help plan, decide, and improve health efforts. When people are involved from the start, the programs better match what the community really needs. The process begins with identifying who has a stake in the health issues. Some might have influence, others might be directly affected. Building trust is key, so open conversations and honest relationships are encouraged. When diverse voices are heard, especially those experiencing inequality or health disparities, the programs become more effective. This inclusion helps reduce resistance and builds trust in the community. It also makes health initiatives more sustainable because they reflected real community needs. Stakeholder engagement can happen at different levels. Sometimes, it's just sharing information about plans. Other times, it involves actively asking for input and letting community members help shape decisions. Moving beyond just informing, real engagement means listening to feedback and letting it influence policies and actions. This approach helps address healthcare disparities by making sure solutions consider the experiences of marginalized groups. It also takes into account social factors like poverty, housing, and environmental issues that impact health. Practically, engaging stakeholders can include holding community meetings or focus groups to gather ideas. It can mean inviting community representatives to join advisory councils or planning teams. Working with local organizations that serve vulnerable populations is another way to connect. Using feedback tools, like surveys or suggestion boxes, helps adapt programs to fit community needs better. Building long-term relationships ensures health improvements last beyond initial projects. When community health initiatives include stakeholder engagement, they become more inclusive and responsive. They can better address social issues like inequality, homelessness, climate change effects, and poverty that influence health. This process helps create healthier, fairer communities where everyone has a chance to thrive.